Have you ever truly looked at your tongue? Not just a fleeting glance in the morning, but truly paused, leaned in close to the mirror, and examined its unique landscape. Most people don't realize that this surprisingly complex muscle, which guides our words and savors our meals, is quietly serving a far greater purpose than we imagine. It's a vigilant, daily reporter, a profound early warning system for the intricate workings deep within your body, holding secrets to your overall health. What if a quick, almost intuitive 10-second inspection could reveal something vitally important about the state of your cardiovascular health, long before any of the conventional symptoms ever even begin to whisper? Could your tongue be attempting to send you a crucial signal about something as serious as heart blockage, and is there one particular color you simply cannot afford to ignore? It feels like a paradox, doesn't it, to associate the flexible, moist surface inside our mouths with something as formidable and internal as our heart and circulatory system. Our common understanding of heart health leans towards visible markers, cholesterol numbers, blood pressure readings, maybe an occasional ache or pressure in the chest. We are taught to look for those more direct signals, yet the body, in its boundless wisdom, often offers us subtler clues in the most unexpected places. Your tongue, with its ever-changing hues and textures, quietly tells a story every single day. It's an open book to those who know how to read its pages, capable of reflecting not just a passing discomfort, but also a more profound internal state that warrants deeper attention. A truly healthy tongue is usually a vibrant, supple pink, with a gentle scattering of tiny bumps, known as papillae, which are vital for taste and give the surface its slightly velvety texture. It should appear moist and full-bodied, a sign of adequate hydration and healthy blood flow. This idyllic picture of a pink, lively tongue speaks volumes about the harmonious balance within your internal environment. It whispers of good circulation, proper nourishment, and a system largely at peace. However, life with its demands and hidden stressors rarely offers a perpetually balanced state. Diet choices, moments of stress, certain medications, and even environmental factors can cause minor, temporary deviations from this baseline. These small, fleeting shifts are often harmless and quickly resolve. But when certain alterations in color, in texture, or in the very nature of its coating persist, when they become a steady hum rather than a passing note, your tongue might actually be reaching out, trying to draw your gaze to a more substantial message about the hidden landscape of your inner health. Consider this remarkable fact. For centuries, various healing traditions across the globe have understood and practiced tongue observation as a foundational diagnostic tool. Long before modern diagnostic technologies came into being, wise healers relied on careful, nuanced observations of the tongue, understanding it as a true micromap of the body's entire system. In our fast-paced modern world, we often rush past such time-honored insights, preferring the seemingly more concrete data of machines and tests. But imagine for a moment embracing a simple, profound daily ritual, taking just a moment to genuinely look at your tongue. What if this brief daily check could help you attune to your body's intrinsic wisdom, catching vital signals that might otherwise linger unnoticed for too long, slowly evolving into something more formidable? It's like having an internal check engine light for your body. Sometimes it indicates something simple, sometimes a complex underlying issue, but either way, it's giving you information you desperately need. The crucial understanding here is that your oral health isn't some separate, isolated chapter in your health story. No, it's deeply, irrevocably interwoven with the entire narrative of your systemic well-being. Your mouth serves as the primary gateway to your digestive and respiratory systems, a bustling ecosystem teeming with a vast, diverse community of microorganisms, bacteria, fungi, and viruses, both beneficial and potentially harmful. When this delicate balance is disrupted, particularly by an overgrowth of certain problematic bacteria, it doesn't simply cause localized issues like bad breath or cavities. This imbalance can trigger a domino effect, initiating a cascade of inflammation and health consequences that extend far beyond your oral cavity. Growing scientific evidence rigorously demonstrates that the old saying, "What happens in your mouth stays in your mouth," is profoundly inaccurate. In truth, your oral health profoundly influences and is influenced by the health of your entire body. One of the most potent and extensively researched links in this oral systemic connection involves chronic inflammation. When gum disease, medically known as periodontitis, takes root and becomes persistent, the unrelenting presence of specific bacteria within your mouth isn't merely content with damaging your gums and supporting bone structure. These bacterial invaders and the body's constant fight against them trigger a low-grade, simmering inflammatory response. This inflammation isn't confined to your mouth. These inflammatory compounds, and indeed some oral bacteria themselves, can gain entry into your bloodstream. Once in general circulation, they significantly contribute to your body's overall inflammatory burden. This chronic, systemic inflammation is a silent but potent accelerant for the development and progression of atherosclerosis, the insidious hardening and narrowing of arteries due to fatty plaque buildup. And atherosclerosis, as we know, is the primary underlying cause of coronary artery disease, heart attacks, and strokes. Prestigious institutions like the American Heart Association, Mayo Clinic, Harvard Health, and the Cleveland Clinic consistently highlight this profound interplay, emphasizing that untreated gum disease significantly increases one's risk for cardiovascular events. Some compelling studies even suggest that individuals with periodontitis face a substantially elevated risk of experiencing heart attacks or strokes compared to those with healthy gums. This intricate web shows us why even the smallest details of your oral health can provide valuable insights into your cardiovascular vitality. So, if your tongue truly serves as such a sensitive barometer for internal inflammation and potential circulatory issues, what precisely should you be looking for during your 10-second inspection? And what specific color holds such paramount importance that it warrants immediate, unwavering attention? While mainstream Western medicine may not define a single, unequivocal heart blockage color for the tongue, persistent and unusual changes in its appearance can indeed function as incredibly vital early warning signs. These subtle visual cues often signal a deeper systemic issue that calls for a comprehensive medical evaluation. Let's remember that the ideal tongue is uniformly light to medium pink, with a thin, almost translucent white coating, appearing consistently moist and covered in those distinct small velvety papillae, especially noticeable towards the back. Now, let's carefully explore the spectrum of colors and conditions that might gently, or perhaps urgently, prompt you to seek medical guidance. Consider a pale tongue. If the normally vibrant pink of your tongue appears unusually light, almost washed out, or distinctly white in a way that's more than just a light, normal coating, it's a quiet whisper from your inner systems. While a temporary white coating might be attributed to minor factors like dehydration, dry mouth, poor oral hygiene, or a diet rich in soft, processed foods that don't adequately scrape the tongue's surface, a true pallor of the tongue tissue itself can be a more profound indicator. This type of paleness often signals deeper nutritional deficiencies, most commonly a lack of essential iron or vitamin B12. Both of these nutrients are absolutely critical for the efficient production of healthy, oxygen-carrying red blood cells. Anemia, a condition defined by insufficient healthy red blood cells, thus reduces the amount of oxygen transported throughout your body, visually manifesting as a pale tongue and inner lips. While not a direct sign of imminent heart blockage, anemia places a substantial strain on your heart, forcing it to work much harder to pump the limited oxygenated blood around your system. Over extended periods, this additional workload can indeed contribute to the overall burden and risk profile for developing or worsening cardiovascular disease. Then we consider the red tongue. While temporary staining from consuming certain vibrant foods or drinks is normal, a consistently bright red, almost scarlet, or even a deeper, darker red hue that pervades the actual body of your tongue warrants attention. A tongue that is uncharacteristically red, sometimes described as a strawberry tongue when accompanied by small, raised bumps, can be linked to certain acute infections, such as scarlet fever, or significant vitamin B deficiencies. A deeper, more uniform dark red coloration might point to a state of heightened inflammation, or what traditional practices refer to as heat within the body, indicating an active and often widespread systemic response. It's particularly insightful that some clinical observations and preliminary research building on age-old diagnostic methods, have noted that individuals suffering from chronic heart failure frequently present with a distinctly redder tongue that often carries a subtle yellowish coating. Intriguingly, this specific presentation can become even more pronounced as the cardiac condition progresses. Such persistent redness generally suggests underlying conditions that elevate your overall cardiovascular risk profile, most often tied to an amplified state of systemic inflammation. It strongly implies an internal environment that is far from calm and balanced, signaling that further investigation by a healthcare professional is genuinely prudent. However, amongst all the possible visual clues your tongue can offer, there is one particular color change that signals an immediate and unequivocal medical emergency. It is the color that demands your utmost vigilance, the one you absolutely cannot under any circumstances afford to ignore. This critical indicator is a blue or purplish tongue. This specific striking transformation of color carries the highest degree of urgency precisely because it is almost always linked to cyanosis, a stark medical term meaning there is an insufficient amount of oxygen circulating in your blood. When your blood fails to receive adequate oxygenation in your lungs, its usual vibrant, healthy red hue darkens, transforming into an ominous bluish-purple tint. This dramatic shift in blood color then becomes visibly apparent in areas where blood vessels are close to the surface, such as your lips, fingers, toes, and most prominently, your tongue. A persistently bluish or purplish tongue is an unambiguous alarm bell. It strongly indicates a severe underlying circulatory issue. Significant cardiovascular compromise, like acute heart failure, or a critical lung condition that is impeding proper oxygen exchange. This isn't a signal to calmly observe and consider. It is a direct, visual plea from your body that your vital organs are critically starved of the oxygen they absolutely depend upon to function. If you or someone you are with observes the tongue turning blue or purple, especially if accompanied by other concerning symptoms such as severe shortness of breath, extreme fatigue, confusion, or chest discomfort, you must seek immediate emergency medical attention. This is a critical situation where every second counts. Beyond the stark colors, even the subtle nuances of the coating on your tongue can whisper stories. A healthy tongue, as we discussed, naturally carries a thin, almost translucent whitish coating, a perfectly normal composite of shedding cells, beneficial bacteria, and saliva. However, an excessively thick or tenacious white coating that covers the majority of the tongue, resisting gentle scraping, can signify a few different things. It might suggest persistent poor oral hygiene, chronic dehydration, severe dry mouth, or more significantly, an overgrowth of bacteria or fungi, such as oral thrush, candidiasis. While often localized and treatable, a persistent, very thick coating can point towards a fundamental imbalance in your oral microbiome, which often mirrors dysbiosis within your gut, and by extension, contributes to broader systemic inflammation. In the perspectives of various traditional medicine systems, a particularly thick white coating can also suggest sluggish digestion or an overloaded detoxification system. Similarly, a pervasive yellowish coating on the tongue, distinct from temporary staining after an espresso or curry, can be a telling symptom of excessive bacterial proliferation, especially if it co-occurs with inadequate oral hygiene or chronic dry mouth. In less common but more serious scenarios, a generalized yellow tint to the tongue surface and even the skin could hint at underlying liver issues like jaundice, or even an unregulated metabolic condition such as diabetes. Given the intricate, acknowledged connection between our gut health, levels of inflammation, and overall cardiovascular well-being, any consistent or pronounced deviation from that typically light, healthy white tongue coating deserves your attention and potential medical inquiry. Even the texture of your tongue itself holds important clues. A remarkably smooth, almost glossy appearance to your tongue, particularly if it feels sore or appears unnaturally red, often indicates significant nutritional deficiencies, notably shortages of iron or various B vitamins. If the delicate normal papillae that usually cover your tongue diminish or disappear, creating that slick surface, it can be indicative of more chronic, widespread inflammatory conditions within your body. Conversely, deep fissures, cracks, or unusually prominent groves across the tongue's surface might suggest chronic dehydration, or again, underlying vitamin deficiencies, subtly signaling deeper internal imbalances that need correcting. Moreover, an abnormally swollen or noticeably enlarged tongue could be a silent sign of systemic fluid retention, a generalized inflammatory state, or once more, a crucial deficit in specific B vitamins. It becomes clear then that the intricate ecosystem of your mouth, and particularly the expressive canvas of your tongue, genuinely serves as a powerful micromirror, faithfully reflecting the health of your entire physiological system. It is abundantly clear that these subtle visual signals from your tongue are not merely isolated or inconsequential occurrences. Rather, they are vital ripples on the surface that strongly indicate more powerful, often hidden, currents at play within your delicate physiological landscape. To disregard or simply overlook these potent messages from your own body could mean tragically missing crucial windows for timely intervention. This prolonged neglect can permit silent inflammation, unchecked oxidative stress, and persistent circulatory stressors to continue their subtle yet relentless damage within your body, day after day. Chronic, low-grade systemic inflammation, for instance, operates as a relentless, invisible adversary, contributing insidiously to the stiffening and narrowing of your arteries, fostering the dangerous formation of atherosclerotic plaque that, without warning, can lead to devastating heart attacks and debilitating strokes. Suboptimal circulation, long-term nutrient deficiencies, and an environment of unchecked bacterial overgrowth, whether in your mouth or elsewhere, together create a dangerously fertile ground where these more severe and life-threatening cardiovascular conditions can quietly take root, grow, and ultimately flourish. While the human body possesses an astounding capacity for self-regulation and healing, it truly thrives and performs optimally when we remain attuned to its eloquent yet subtle warnings and act decisively upon them. So, for you, the now more mindful observer of your own intricate body, what are the tangible, practical steps you can take? First and foremost, lovingly cultivate the habit of truly observing your tongue. Make it an ingrained, natural part of your daily hygiene routine, just as essential as brushing your teeth. Invest those 10 seconds. Become deeply familiar with your unique normal, that healthy, vital shade of pink that signifies your well-being. If during your regular observation, you genuinely notice any persistent and unexplainable changes, that strikingly vivid blue or purplish tint that lingers far beyond a fleeting moment after consuming certain food or drink, a consistently alarming paleness that affects the body of the tongue, an unusually deep and unchanging red hue, or a thick abnormal coating that resists your usual cleaning, do not, under any circumstances, casually dismiss it. Pay keen attention to any other accompanying symptoms, no matter how minor or generalized they might seem. A persistent, uncharacteristic fatigue, unexplained shortness of breath that you've dismissed, or just an overarching, lingering feeling of being unwell or off. This vital process isn't about fostering anxiety or encouraging self-diagnosis in place of professional medical advice. Instead, it is about nurturing profound self-awareness and adopting a genuinely proactive stance toward your personal health journey. If, after your careful daily checks, you genuinely observe any of these lasting and unusual changes, especially the profoundly serious blue-purplish discoloration, the critically important next step is to initiate communication with a trusted healthcare professional without any undue delay. Be clear, calm, and articulate as you share your observations about your tongue, and meticulously describe any other accompanying symptoms or sensations you've been experiencing. A skilled physician, or sometimes your dentist, in conjunction with a medical doctor, can then accurately assess these oral signs within the broader context of your complete medical history and overall health profile, performing appropriate diagnostic tests if warranted. They are best equipped to expertly evaluate for potential underlying nutritional deficiencies, identify states of systemic inflammation, or discern whether more serious, fundamental cardiovascular or respiratory conditions might indeed be subtly manifesting in your oral cavity. Ultimately, empowering yourself with this deepened knowledge and mindful awareness transforms you into an even more engaged and informed participant in your personal health odyssey. Simple yet powerful daily habits, such as consistently observing your tongue, meticulously practicing optimal oral hygiene, which means thoroughly brushing twice a day, flossing diligently, and even gently cleaning your tongue, contribute significantly to mitigating and reducing pervasive systemic inflammation throughout your body. Making a conscious choice to embrace a wholesome, nutrient-dense diet naturally supports the optimal functioning of your entire physiological system, fueling vibrant circulation and bolstering a robust immune response, both of which are foundational for a healthy, resilient heart and indeed a healthy, expressive tongue. Remember, your tongue does far more than just process the food you eat. It sensitively mirrors the depth of your nourishment, eloquently reflecting both vital sufficiency and concerning deficiencies. In a modern world that often impulsively chases after superficial quick fixes and all too frequently overlooks the profound significance of subtle, nuanced physiological cues, pause for a moment to truly appreciate the inherent wisdom and poetic language of your own remarkable body. Your tongue, an incredibly resilient, expressive, and often overlooked organ, offers you continuous, intimate glimpses into your intricate internal symphony. It silently validates that intuitive gut feeling, that sense that perhaps beneath the surface, something isn't entirely right, even if you can't quite put your finger on it. Trust this intimate messenger, this small but mighty truth-teller, and gracefully honor its quiet yet potent calls, for within the ever-shifting tapestry of its colors and textures lies not only the crucial potential for vitally early detection, but also a renewed and profound invitation to recommit to caring for the magnificent vessel that is you. The gentle, silent whisper of your tongue, especially when it reveals that one specific, unmistakable color, is a powerful, caring summons. It urges you to listen with greater depth, to act with courageous swiftness, and to embrace the truly empowering truth that within you lies many of the vital keys to your own lasting well-being and deepest vitality. If this intimate conversation about truly listening to the intricate language of your body has resonated deeply within you, if it has genuinely encouraged you to pause and intentionally look inward, please take a moment to press that like button and feel free to share your own insights and reflections in the comments below. And if you yearn for more insightful explorations into the myriad unexpected ways your extraordinary body communicates its profound needs and deepest truths, consider gently subscribing to our channel. It is a shared journey, one that we navigate together, moving steadily towards a more understanding, more empowered, and ultimately a more truly authentic you.